July 31st, 2014. Guys, sometimes I really wonder about the CDC and people like who that run this world and what their intentions really are. We've heard about the Georgia Guidestone and population getting out of hand according to the people that rule this world. But they sent a plane at 5 o'clock this afternoon to Africa to bring back the first Ebola patient to the U.S. I want to read the article. It says, one of two Americans infected with Ebola in West Africa will be brought to the United States for treatment at Emory University. So Atlanta, get ready. Now, CDC's there, also CNN. But, guys, does that really sound wise? I mean, they're spending what money they have to try to contain it there. Who announced that they were going to send some more money in that area? But this thing is spreading fast, and there's no cure for it. So we're going to send a plane to Africa and bring it back here. What kind of planning is that? It sounds like a population thinning. Maybe the Georgia Guidestone, since we're dealing with Georgia. It says one of two Americans infected with Ebola in West Africa will enter the U.S. For treatment at Emory University in Atlanta. It says according to an internal memo sent to physicians on Thursday. The memo did not indicate time of departure, time of arrival, or the exact identity of the patient. We have two American citizens there now. It says, in absence of specifics, the hospital says it's prepared and ready for the arrival with a highly specialized, isolated unit. Does this sound like a science fiction movie? Suddenly, it sure does to me, guys. I can't help it. It says it was designed with the help of the Center for Disease Control and Prevention, headquartered nearby. CNN reported that a specialized medical plane was already en route to Liberia on Thursday night, and I verified that. It left at 5 p.m. That's what I was saying. So staff at the hospital have reportedly been highly trained. How do you get highly trained for disease that you've never dealt with here in the U.S. that has no cure for it? You're going to fly in and out of Africa. He said, as well as they're aware of unique protocols that will be necessary to treat the patient. Vince Dollard, Associate Vice President of Communications for Emory. Vince, are you going to be the one that allows us in? Declined to say who the arriving patient is exactly, but did confirm that it was either Dr. Kent Bradley or Nancy Wrightwold, two U.S. charity workers infected in Africa. Both remain in serious condition. Wrightwold received an experimental serum Thursday afternoon while Brantley was given a blood transfusion. It says this is the first time a patient infected with the Ebola virus, which can kill up to 90% of the people it infects in a matter of days, has been brought to the United States or the Western Hemisphere. Guys, it's out of control. Our government is out of control. The disease is spread via bodily fluids, necessitating strict isolation for the patients and thorough decontamination. Healthcare workers like Brantley and Wrightwold place themselves at great risk to treat diseases like Ebola. Now, I was reading articles about that area. They do not trust these doctors from CDC and WHO or any of these places. Now, I'm not sure why they don't. I don't trust them either, but they think that they have something to do with the spread of it, so they will not report it. And if one of the patients do die in the hospital, they will steal the body from the funeral home to get it away from what they're calling the white witch doctors and bury the body, and thus infecting the whole tribe. It says in a call with reporters Tuesday, Stephen Monroe, Deputy Director of the National Center for Emerging and Zoonotic Infection Diseases at the CDC, assured listeners that the outbreak posed little risk to America, adding that the chances of anyone infecting arriving undiagnosed were slim. In another call Thursday afternoon, CDC Director Tom Friedman said plans were in place to stop Ebola-infected people from boarding planes in West Africa, and they're grounding flights all over that area. Everyone except us, we're going to I mean, yeah, I feel sorry for their families, guys. But there's no cure. It's a bad science fiction movie. Let me just continue reading. It says, after advising against travel to the affected areas, Frieden said increased caution is warranted. Yeah, I think it might be. The bottom line is that Ebola is worsening in West Africa. He said that CDC plans to send 50 more staff members to Liberia, Guinea, and Sierra Leone in the next month, adding to the dozen CDC workers that are already there. It will take many months and it won't be easy, but Ebola can be stopped. But you know the only way they've ever stopped it was complete isolation. That's why they're stopping flights over there, but they're going to bring it here first time. Not just the U.S., again, in the Western Hemisphere. Thanks, CDC. Now, the Emory University responded to the notice, and it says, please be assured that our hospital is prepared and ready. We have highly specialized, isolated units in the hospital that was set up in collaboration with the CDC to treat patients who are exposed to certain infectious diseases. The unit is physically separate from other patient areas, but the workers are the ones that are spreading this. Guys, if I was you and you were anywhere near that place, I would walk out now. In fact, Emory University, they said, is just one of 4 facilities in the entire country with such a specialized unit. So look for the news, guys, in the next few days to the other 3 start getting these patients. It says that Emory University hospital physicians, nurses, and staff are highly trained in the specific and unique protocols. What is specific and unique? You can only isolate this thing and procedures necessary to treat and care for this type of patient. For the specially trained staff, these procedures are practiced on a regular basis throughout the year. So we are fully prepared for this type of situation. Now, the number 1 doctor that's been over there died. It was yesterday or today. He knows more about this than all of these guys put together. But bring it on over. Let's follow the Georgia Guidestone. Let's clean America out. Watch for a couple of things. If they bring it over here, it will get out. Now, will they call for mass vaccines? And most of the vaccines have never worked and they really don't have one now? Or will they call for mass isolation in FEMA camps? Is this just a false flag? It's a heads up, guys. Be safe. We're going to update it.